At some point in your student life, either by utter curiosity or excessive boredom, I'm sure you have taken quizzes looking similar to these. Or maybe a few of the more serious and legitimate tests of career or personality aptitudes to determine various future career suitability measures. If you agreed to my prior question on whether you took a similar test yourself at least once in your life, I'm positive you've somewhat disagreed or doubted the results then. Not just by the vague gut feeling, but surprisingly, aptitude tests have been severely criticized for poor predictive validity. Even official career tests such as the Myers-Briggs aptitude tests are considered inaccurate most of the time. As a result, in employee selection of most workforces, aptitude tests score at the bottom of the criteria used, a correlation of 0.22 or less with workplace performance. If popular aptitude tests cannot be trusted, what else shouldn't be? Similarly, the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM, categories should be viewed with some boundaries, although their uses are understandable. By labeling the DSM, the mental health professionals would get the precise treatment options with background, basis, and codes for insurance reimbursements. The clients themselves would rely on the mental disorder labels as they provide a long-lost answer to their psychological symptoms, as well as deep relief as they suggest that the conditions have been studied with treatments developed. In other words, they could feel belonging to the commonized group of people with not the same, but only similar conditions. On the other hand, mental disorder labeling may result in various disadvantages. Ironically, labeling people as to being diagnosed with a certain mental disorder could worsen the effects mentally. This tendency for people to feel worse at themselves because of being diagnosed as having a certain psychological condition is called mental aggravation. In other words, labeling a person with major depressive disorder or bipolar personality disorder can make the person feel like a profoundly wounded, mentally ill patient. Even Thomas Inzel, the former director of the National Institutes for Mental Health, stated that the agency would no longer rely exclusively on the DSM criteria due to their lack of validity. Additionally, the lack of validity of the DSM criteria is well known. A study criticizing the accuracy of psychiatric diagnosis was conducted by a psychologist called David Rosenhan from Stanford in 1973. This experiment, under the title On Being Sane in Insane Places, consisted of two parts. The first part involved 8 healthy associates, or pseudopatients, who faked symptoms of having auditory hallucinations. When enrolled in 12 different psychiatric hospitals across the United States, 7 of the 8 pseudopatients were diagnosed with schizophrenia and given antipsychotic drugs to treat their faked conditions. The pseudopatients spent an average of 19 whole days in psychiatric hospitals. The second part of the Rosenhan experiment dealt with an offended psychiatric hospital after the results of the first part that claimed that their facilities were trustworthy. The hospital challenged Rosenhan to send pseudopatients to its facility, whom its staff would then detect. Of 250 new patients in the following weeks, the staff identified 41 potential pseudopatients. However, Rosenhan had sent no pseudopatients to the hospital from the beginning. From the two parts of the Rosenhan experiment, the invalidity of the diagnosis of psychiatric findings, which is the DSM, was proven. In conclusion, the DSM criteria of directly labeling mental disorders are not only invalid from the situation and example of the Rosenhan experiment, but could be seen as a form of overreacting to a situation. For instance, I would have been diagnosed with ADHD without a doubt if I was growing up in today's world. As an energetic child with mild behavior problems of not being able to control certain emotions of excitement or joy, I could be declared as having ADHD. Even from occasional mood swings or shifts of emotions, someone could be identified as having a bipolar personality disorder. Dr. Kristen Madsen, a medical social worker, has stated that the result of the emphasis on DSM labeling is that people are now being defined as their mental disorders rather than being perceived as having encountered certain obstacles in their lives with which they are struggling with, furthering the psychological disadvantages that the DSM criteria bring. Consequently, although the DSM labeling of mental disorders is helpful when diagnosing patients and resulting in potential solutions to their symptoms, it might not be the best option. As a result, as psychiatrist Kristen Matson stated, some struggles in life could simply be certain obstacles in life that you are to overcome. With this in mind, rather than classifying and diagnosing yourself as a mentally ill patient, it could be a more effective method to try to overcome those challenges in life and live out with confidence. And when you thrive to do so, you might even look back to see that it was simply a mild obstacle in your long life. Thank you.